Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
All right. Happy Q&A day. We are Thursday, which means it is Q&A day. So first question.
Hi. So I have a couple questions. One is regarding concussion-related POTS. So I walk quite a bit on a daily basis. But I did notice this past Sunday when I was doing portraits, I and I was going from kneeling to standing and just walking and stuff. I just noticed that I was very out of breath, and then I had headaches afterwards. So is that a POTS thing, or I hadn't been doing very much running or anything any crazy cardio, but I have been walking a lot consistently for many months. So I was just wondering.
Have you tested yourself for POTS?
Not yet. I still have to get the blood pressure, heart rate thing. So I still have to do that.
That you got to do that before you can really have any idea.
Okay. The second question is, for the vestibular and visual exercises, if it doesn't cause dizziness, but it causes aggravates symptoms like headache or just feeling off, I probably should just keep doing them if it does that, or what should I do if it doesn't cause dizziness, but it just makes me have headaches?
Well, so I mean that's a good question. So when you look at something like the vestibular ocular motor screen, which is what we use for that type of assessment, the symptoms that you rate are headache, dizziness, fogginess, and nauseousness.
Okay.
And generally, if any symptom increases, if your overall symptoms increase by 2 or more points with any one test from your baseline, right? So before you do the test, okay, how's my headache? 0 to 10. How's my dizziness? 0 to 10. How's my nauseousness? 0 to 10. How's my fogginess? 0 to 10. Then you do a particular assessment, right? So let's say the first one is smooth pursuit eye tracking, right? So you go back and forth, up and down. Now you rate your headache, dizziness, nauseousness, fogginess from 0 to 10. And if the overall score, that score out of 40, right, all 4 added up, if that increases by 2 or more points on any particular assessment, then that's one you would want to put a little check mark beside as something that you may want to do in terms of rehab, right? Now, when it comes to headaches, though, because if you think about what you're doing, right? So do you know which tests aggravate you?
Yeah, the wall clock, specifically going to the left, aggravates me most.
with turning your head or just visual motion?
Just visual motion.
Okay.
I guess I haven't done that one with turning my head yet, but
Well, when you do the vestibular ocular motor screen, right? Like the first one is smooth pursuit tracking. The second one is saccades, where you look back and forth, and then up and down, up and down. And then the other one is VOR, where you turn your head side to side and keep your eyes fixated on a target side to side, and then up and down like this with your eyes fixated on a target, right? And then the other one is where you put your thumbs together and you twist your whole body, right? Have you done that?
yeah, I did the twisting my whole body with the thumbs, and that aggravated it. And then like the one that's a wall clock, where you put this markings on the wall and then move your eyes in a circular direction.
Yeah. So that's the rehab exercise for it.
Oh,
But you would only do that if you were aggravated by the saccade, where you're going side to side with your eyes.
okay. Well, yeah, I guess I still am aggravated by it. I hadn't done those in a while because I did those like a while ago. Like I did things kind of out of order just because I was.
And now you're all messed up, right? That's why we want to do things in the right order, because otherwise now it's like creates this confusion picture, right?
Yeah, what was before I even started this program? Like I was doing.
Oh, okay.
Different therapies. So.
Yeah, that's fine. So where are you at in this particular program?
I'm in the vestibular section.
So you're at that section anyway.
Yeah, but I still do think my neck needs work. It's just I've been working on my neck, having work on my neck for a long time.
Yeah. So anyway, when you move your eyes and it causes headaches, usually to me that's like a telltale neck related headache. Because every time your eyes move, it's engaging muscles in your neck, and those muscles tend to refer pain into the head. So if it's dizziness, then rehab is where you want to go, right? If it's dizziness, you feel off, you feel like, it makes, you kind of feel foggy, you're off. That's good. Keep doing the rehab. But if the only symptom is headache, to me that points more towards a neck issue.
Yeah.
And you need just to find the right person to fix that. And so if you've been getting therapy on your neck for a really long time and it's not working, it means you're just getting the wrong type of therapy or seeing the wrong type of practitioner. Like if you see somebody who knows what they're doing, like they should be able to pinpoint exactly where that headache's coming from and be able to release that pretty quickly. Like within a couple sessions, you should make a huge difference.
Okay. Well, it seems like it will make a difference. It just doesn't last very long.
Yeah, and that's common too, right? So sometimes I'll see somebody, they'll feel good for 2 days and then it comes back, right? So then what I'll do is I'll try to increase the frequency of those visits so that I'm seeing them more frequently so that it doesn't have a chance to come all the way back down to baseline. I'm kind of building on the momentum of where they're at, and then eventually I can pull back on it. And then the next part is now, okay, if we get to a point where it's not holding, now maybe we need now we start adding in stability training and different rehabilitation exercises to try and strengthen things.
Okay. Yeah. I've been doing PT, and manual going to chiro. So.
But you're still at a place. Like, how long does your treatment effect last, would you say?
It used to be less time, but I think now it will be like 1 to 2 days.
It's only 1 to 2 days still? How long have you been going for?
Since last February.
Yeah, something's missed here. Something's missing. It shouldn't be like that. Like, oftentimes where practitioners go wrong is that if something is triggering the headache, let's say, they'll focus in on that one area and they'll release that. But the issue is that particular area of tension is likely being caused by some other kind of biomechanical issue that they're not addressing, and that's why it keeps coming back.
Yeah.
Right? So if what's a good example of it? The shirt thing, right? So like one of my mentors used to grab your shirt and pull on it from the front, and he'd say, "Where does it feel tight?" Well, it feels tight around the back of my shoulder. And he goes, right, but where's the problem? Well, it's my hand grabbing your shirt. That's the problem. So what you're probably getting done is that you have this area of tension that's causing your headache. They'll go in and work on the back of the shirt.
Yeah.
And that gives you a little bit of temporary relief because you release that muscle but the problem is still there, which is the hand is still pulling on the front of the shirt. So you leave 2 days later, that pull on the front of the shirt has just started to make that tight and aggravated again. So what they need to do is figure out why this is feeling tight on the back, and they need to figure out where this hand is and release that.
Yeah, I remember you saying that last time.
And so that's usually where a lot of practitioners go wrong, right? They focus on the site of pain. Another example is like knee pain. People that have knee issues, it's never a knee problem. It's an ankle or a hip problem.
Mm-hmm.
And if they just focus on the knee, like, oh, my knee hurts. Okay, well, I'm going to rub your knee. Yeah, it'll feel better for a couple days, but it's not actually fixing the problem. Until you go to the ankle and the hip and identify the true problem, you're never going to relieve that knee pain. So same kind of deal. You need to find somebody who maybe thinks about it more globally, that's going to look at it more as like a complete picture. And that's probably the trickiest thing to find.
Okay.
So I would just keep looking. I would try to find different practitioners because the ones that you have right now are not doing it for you.
Okay. Sounds good.
Yeah.
Thanks.
But it sounds like this is a neck problem, right? Like the fact that when you're doing eye movement, it's causing a headache. That's not something you can just like rehab away, right? That's like a response. Every time your eyes move, muscles in your neck engage. And if those muscles are dysfunctional or whatever, they're going to start to cause a headache. So if you just keep doing those eye exercises, all you're doing is causing headaches. You're not doing anything to improve that.
Yeah.
Instead, it's like we got to figure out, okay, let's say it's the suboccipitals that are driving those headaches. And when I push on the suboccipitals, I can cause that headache. So I know it's the suboccipitals. But now I have to start thinking, okay, why are the suboccipitals tight? There's a good chance that you're tight through the pecs, you're tight in your subscapularis, you're tight in all this stuff that pulls your shoulders forward. And as a response to that, upper back curvature, your neck is probably sitting forward, which is then causing the suboccipitals to be tight. So if I go in there and work on the suboccipitals, you're going to get momentary relief, a couple days, and then it's going to come back. Why? Because the posture and all the other stuff is still there that's pulling everything down, that's causing that to be tight.
Yeah.
So it's like we need to like work on getting the shoulders back and up. There's some exercises in the neck module that would probably help too, just from a postural correction standpoint.
Yeah. We've been working on like some back stuff for
back stuff, but I'm talking about front stuff. Anyone work on your chest? Anyone work on your armpits?
A while ago.
I would probably go back to that. That's usually or the front of your neck. Anyone work on the front of your neck?
Not really recently.
Yeah, that's a huge one. I find
that's a big one. I even had somebody in the UK tell me that their PT told them that you can't work on the deep neck flexors, and so they're not going to do it. And I'm like, oh my god, I work on these things every day. You can totally work on them, and they're probably one of the most important.
Yeah, totally. I feel like that's important, not just exercises right there, but yeah, I'm just
I can hear the frustration in your voice.
Yeah, I'm just getting exhausted with having to like explain all the time to providers.
I know. Where are you located?
Colorado.
The guy who invented ART is from Colorado. Be sweet if you could get in to see him. Pretty sure he's from Colorado.
Who is that?
His name is Michael Leahy.
Oh, okay.
I don't know if he's seeing patients anymore.
Yeah, he's an older guy. I don't know if he's.
Yeah, I wonder. We talked about this from so many angles, and we sense your frustration. I wonder if there's like a, top 3 things we can suggest for her moving forward that can simplify, all these different possibilities and what might be happening, because it is overwhelming, right? None of you that have PCS are educated in the anatomy of the head and neck, so it's sort of this sense of trying to break it down so it feels manageable.
Right.
Where to start?
I might offer one thing, and I think Cam, you're bang on with your kind of like thought process there in the neck. But a lot of people ask us questions in this program, very similar to what you just did. And so basically, what's the first step? And I think the first step is see if the current provider team that you have can help you with when you give them a little bit of direction. Like, so you're part of what we're trying to do here is educational, right? We're trying to help people. We know you can't treat yourself. You can't put your hands on yourself fully and treat and address the underlying issues. However, you can convey, have we worked on the front of the neck? Just something simple as that.
I just need to remember to ask that next time, because I have told them, like, hey, I think the suboccipitals and the SCM need work. Like, I did tell them that, and we worked on that, and it did help some, but I forget to tell them about the front of the neck. Like, I have front of the neck exercises, but just we haven't worked on it.
Make a couple notes, like even after the call.
Hold on. Do those exercises on the front of the neck, do they make you feel dizzy or off?
No.
Okay.
Yeah, just to echo Dr. Paul's comment there, sometimes it's helpful to make like a list of 3 things you want to ask. Right, when you're there, give yourself prompts, because it's a lot to try to remember, especially if you're feeling foggy or you're feeling low. It can be hard to advocate when you're not feeling well. So maybe, do yourself a favor, make a couple notes of like, what are the top 3 things I could ask my provider, or even just one question, right? Starting somewhere. It sounds like you've got some great guidance from Dr. Cam today to sort of figure out, what's the priority to ask, what would be most helpful to try.
Yeah.
Okay.
Yeah, and sometimes, like, if a provider is willing to do that, that's a good sign, and that means I think you can continue working with them. I think sometimes you hit a provider that they're like, nope, you know what? No, like they're very closed off, and in general, and doesn't matter. It can be manual provider, it could be other private providers. That's not a great sign. And I also think people get overwhelmed because a person presents with, like just the way that you're talking. It's like, there's obviously a frustration that builds up, and providers sometimes sense that. Like, I work with chronic pain doctors that are great diagnosticians, but they get focused on the fact that a person's depressed. Not saying you are, I'm just saying that a patient that might come into our clinic, they're like, no, you know what? It's a depression problem. You're really, and then they start chalking it up to certain things that, are present, but there may not be the root cause.
Caused by pain or whatever. Or
yeah, exactly.
Exhaustion or
Yeah,
exactly.
100%.
Yeah. So I think that those are challenges. And I think that when we come in with like, okay, so can we address these few things? Make a list for yourself, and then within a few sessions, you should be able to know, is this making me feel better or making me feel worse? Both of those are indicators that things are moving in a good direction. So it could be either one of those. Oftentimes it's I feel worse and then I feel better. And each time I do the treatment lasts a little bit longer. The benefits last and stay a little longer. Now, all that being said, there could be some underlying things like a hormonal imbalance. I mentioned mood issues that prevent that treatment from sticking longer. So there are other factors. Hopefully, if you've gone all the way to the vestibular section, you've made it through the whole course. And if that means you have to maybe go back and look at a couple things that you flagged, I need to think about this again. You know what? That might be helpful. And then I would encourage you, make some notes on areas that you're still struggling to implement. Are you finding a time to be mindful and meditate every day, or at least do some deep breathing and do some mindfulness? All these pieces help the physical, which is a lot of where your symptoms are stuck right now with what just Cam mentioned. They help the resolution of those symptoms.
Yeah, no, definitely. And I agree. And I definitely thought that to myself, like there's a couple things like the POC section, for example, I need to go back to that.
Yep.
I think hormones might be a piece, but it's kind of like, I did go to an ND and she did look at my supplements and most of it was good. It just, she had me up a couple things.
Okay,
and
good.
Then, we did talk about the hormone thing, and then like she said to give it a few months with like incorporating a little bit of progesterone.
Yeah, progesterone. Yep.
Yeah, so I have like, it's just a topical thing, and it's made from wild yams, so it's like pretty natural. But I'm wondering if I should just ask my MD also just to run a hormone panel just to see where I'm at right now, and then still give it 3 months, and then if it doesn't get better, or if the tests are off, then I can ask my MD and get the more detailed test or whatever.
I mean, if it's covered, absolutely go ahead and do that. However, I think I just might point out, if you've already zoned in on the pot section, that's probably, Dr. Kim asked that question right off the bat, that's an assessment that maybe even is a bigger priority to look at. Okay, so if there is some sort of POTS or dysautonomia that's actually diagnosable, that's a huge factor in your ability to just progress in symptoms and progress, because ultimately symptoms, you were trying to get you to the point that you can do more and exercise more. Steady state cardio is such a powerful tool to rehabilitate your body's mitochondria, which basically can help everything.
Yeah, and I'm doing like, I've incorporated more cardio recently. Like, there's this like Jacob's ladder exercise thing where you don't have to run or anything, but it's very cardio, and it will easily wear me out.
Right. Do you get tons of symptoms after doing that?
What?
Do you get tons of symptoms after doing that?
Yeah, I get some. Mostly it makes me really tired, and then it like some head stuff.
Yeah.
Which makes sense just because like daily life, like I'll run into stuff like that. Right. So it'll just do it quicker because I'm like
bona fide full on POTS. People can't really exercise that much. It's extremely limited. So the fact that you're able to exercise a little bit, or maybe again, we don't know that fully, that's a good sign that your autonomics are maybe not to the point that they're so decompensated to get a diagnosis of POTS. Yeah. But either way, that has to be assessed. Your manual provider should also know something about that. Like if you were to go see Cam, for example, he'd be able to do some basic testing to say, all right, you know what? You do have some orthostatic tachycardia. You do have some orthostatic, meaning change in posture, blood pressure changes. It's normal to have some of that after an injury because your autonomic nervous system is decompensated. However, it doesn't meet the criteria of actually getting diagnosed with POTS. And there's a big difference though.
Okay. Well, I just recently started doing like more cardio. The longest I've done is like 7 minutes, and today I did 4 minutes. I'm just like trying to like see if that helps and see if I can like increase my time.
Are you tracking your heart rate through this?
No, I'm not. I still need to get so I need the blood pressure thing with heart rate, right? Or my phone will do just heart rate, right? What?
Just heart rate.
Yeah, I mean, heart rate's going to be the most important, right? Yeah. It's more common to have POTS, which is the heart rate issue, than it is to have the blood pressure, the orthostatic hypotension issue in a post-concussion situation. But you're saying you're at the vestibular section, but yet you haven't really implemented the exercise portion properly, right? So it's almost like you need to go back and just kind of go through things in a proper way, because it sounds like we're skipping ahead and we're not actually implementing certain areas, and it's going to just fall flat on its face. So you got to kind of do this where you're monitoring the heart rate throughout exercise. You have to find what your threshold is, because it's not about time, it's about intensity. You want to find the rate that you can exercise at 20 to 30 minutes without significantly increasing your symptoms. Okay. And you find out what that heart rate is, and then you monitor your heart rate while you're exercising to stay below that threshold. And then every 2 weeks you retest your threshold to figure out what your new threshold is. Then you drop below that, and you do that for 2 weeks, and then you keep doing that, so you're actually improving your exercise tolerance.
Okay. Well, would that be affecting my neck? Would that be affecting my neck though?
It's all kind of related, right? Like neck dysfunction can increase your risk for autonomic issues. And autonomic issues increase your stress and anxieties, which causes tension in the neck. So they're all kind of related. They go hand in hand.
I mean, that makes sense. It's just.
And typically with neck related issues, people feel better after exercise because you get more blood flow to the area. You have that kind of endorphin release. It helps you on a variety of levels. So when I do a treadmill test on somebody, sometimes we'll have people coming in who haven't exercised in years. We put them on the treadmill and they're like, I actually feel better. And then I go, okay, right away, I'm going, this is probably a neck issue because once their tissue gets warmed up with exercise, all the tension goes away and their headaches disappear. So it could be that there's an autonomic issue that's driving some of this, and we need to just do things in the right way.
Yeah, no, totally. I mean, I agree. I just, so for the heart rate tracking, can I just do that on my phone or do I need something special like when I'm exercising?
You need something that can measure continuous heart rate. So how are you going to do it on your phone? Does the phone have any type of link to your body to measure heart rate, like a watch?
No.
Well, how are you doing it on your phone?
I'm not doing it. I was asking you. I don't have any. I was just asking you. I just know.
You need some sort of
an actual monitor on your.
You need some sort of wearable, right? It can be a finger pulse oximeter, although those are pretty difficult because if you're moving around, they come off your finger. You could use any type of smartwatch. You could get a Polar chest strap, right? Where they're fairly inexpensive. They're probably, I don't know, $50 to get a chest strap, but that will link to your phone and you'll be able to see your heart rate in real time. Because you can't be exercising and then be like, hold on, 1, 2, 3, because then you have to stop, you're counting, and then you have to do math. You need continuous heart rate monitoring, and you need to look down and be like, oh, my heart rate's getting a little high, I need to pull back.
Okay.
Yeah.
Okay.
So any device that can measure continuous heart rate is what you want.
Okay. I think we
got to move on. We got to move on.
Yeah, thank you.
Yeah, you're welcome. Okay, let's go to
just to piggyback on finding providers and that kind of thing. So like our family doctors and MDs, even though they're supposed to be trusted so-called experts and stuff, like mine still thinks a concussion is a brain bruise. And that I should have been fine after 2 weeks max, kind of thing. And then, WSIB is sending us to their specialty clinic and that kind of thing. And their PTs and OTs have never heard of the Canadian Concussion Seminar, like centers and you guys. I'm just like, how? So how do we find people who actually know things?
Well, you're in Ontario, because I can tell by the WSIB comment.
Yes.
We have 90 clinics in Ontario that are certified with us.
Okay.
They know,
but it took me a year and a half to find you guys. Like,
I know.
I know. It's frustrating.
This is the problem right now, is because everything is very medical centric, right? And the evidence shows that physicians don't receive any training in concussion at all.
Right.
Those that do, anywhere before 2012, it was less than 30 minutes in medical school on concussion. If you go to the hospital, the concern is, are you going to die? And so they're looking for things like signs of brain bleeds. And if you don't have that, okay, you're not going to die. Bye. See you later.
Yep.
Then you follow up with your GP, your family doctor, and they're going to be like, oh, concussion. I learned that was a brain bruise back in 1998. And so that's what I'm going with, because I haven't really followed any of the new literature on this topic, right? It wasn't a big component of medical school, so it's a nothing injury, right? So that's kind of where we're stuck in. And then you might get referred to neurology. And neurology, same thing, right? They will do a neurological examination, but in a concussion patient, neurological examinations are normal. So you see the neurologist, they go, okay, do this, do this, do this. Okay, we're going to do a cranial nerve screen. All of that will be normal. So then they'll say, well, your MRI is normal. You don't have a neurological condition. So there's nothing I can do for you. What they haven't figured out yet, and what all the research has said over the past 10 years, is that concussion is treatable, but the treatment is not medicine. The treatment is not neurology. The treatment is not imaging and MRI. The treatment is rehabilitation. And the rehabilitation professionals don't learn this in school either. It's not covered in PT programs. It's not covered in chiro programs. It's not covered in any of these topics, right? Chiro probably covers it the most, and it's only maybe an hour, 2 hours. And it's very general, very basic, right? Here's how you do a scat. Like, it's nothing about actually doing concussion rehabilitation. So the only way that people can get this information is by doing continuing education courses, additional training beyond their curriculum that they did to get their degree.
Mm-hmm.
So it's hard because medicine is just purely looking for, okay, well, concussion, neurological, I'm going to refer you to the next up the chain, which is a neurologist. Then you get to the neurologist, they're like, I'm end of the road. I'm going to refer you maybe to psychology or something like that. They don't even know that rehab is the treatment, and they don't even know to make that recommendation. So you kind of have to be your own advocate, which is unfortunate in the concussion space, but that's usually what ends up happening. Now, we do have a partnership with WSIB. We fit the mid-tier level. So WSIB has like kind of a tiered program. So the first thing is like what they call the POC, which is a program of care, which basically anybody gets with a workplace injury. If you're not getting better with the POC, they typically refer you to either the specialty program, or they refer you to this kind of new kind of mid-level tier, which is like an intermediate thing. And that's where most of our clinics in Ontario fit. But WSIB can refer you to 3 different providers. One of them is CBI, which is like a large chain of physiotherapy clinics. The other one is LifeMark, which is a large chain of physiotherapy clinics, and the other one is through Axia Health, which is our level through Complete Concussion. So you may have been referred to one of the others and not a Complete Concussions provider, and that
I've been to LifeMark.
That's the issue, because they don't have any real training on this either.
That's what I discovered.
Yeah, so what you could potentially do is ask your WSIB person to be referred to the Axia network and Complete Concussions.
Okay.
It's the same program, it's the same compensation level, it's the same everything. It's just they referred you to LifeMark, but really you probably can ask to go to a Complete Concussions provider because they're the ones who we've trained.
Okay.
And it depends on where you're located. They may have referred you to LifeMark because there isn't a Complete Concussions location where you are. Where are you?
I'm in Niagara region.
Yeah, we have, oh my God, we have great clinics in Niagara.
Yeah, I've been cross-referencing the Psychology Today list with the WSIB list and kind of thing to find.
Yeah, I would ask about Niagara Health and Rehab Center.
Okay.
They're in St. Catharines.
Yeah, I think they're on my list.
Yeah, and Brock Pro Health, which is like Thorold area.
Okay.
Those are the 2 clinics we have in the Niagara region. Both are really, really good, very experienced, have been treating concussions for 10 years.
Okay, wonderful.
But that's, and I think they probably are affiliated with this Axia program. Some of our clinics are, some aren't. But you can ask WSIB if they can make a referral to a Complete Concussions location.
Okay, perfect. All right, so that will probably take care of my question. Like, what types of things do you ask your provider?
They'll know exactly
what for the treatments. I'm thinking like the medical practitioners that don't, how you told, like ask your provider to provide a little direction with your providers and that kind of thing. Like if we don't know, how do we know what to ask them? I guess.
Yeah, and that's the challenge. That's why with this program, like what we're trying to do is basically empower you, right? We're giving you that knowledge so that you can go, okay, this is what I need done, because your doctor's not going to know.
Yeah.
That's the unfortunate reality of concussion. Knowledge is really power. It's the more you know, the more you can advocate, the more you can get things done and move forward.
Okay, perfect. So Axia Network.
Axia Network, Complete Concussions
is what I asked for.
Yeah.
Okay, perfect. Thank you.
You're welcome. Okay, next up is.
Okay, great. Oh my God, I can't believe I'm actually talking to you. All right, so this is my issue. I'm actually a cardiac surgical ICU nurse from Boston, and I got knocked over by a snowboarder last February and lost consciousness. And here I am, almost a year later, and I'm still struggling with anxiety and depression and occasional dizziness. I go to the gym, no issues with that. I'm no headaches. I'm cognitive. So one of the things I've tried was, I don't know if you've heard of him, Dr. William Davis. L-glutamine yogurt is supposed to transform your gut. And I did it. I made it. I got the yogurt maker. I made the yogurt. I'm faithful. I've done it for 5 weeks, and it's made me worse. My anxiety, my depression, and yesterday I took it first thing in the morning with followed by water, nothing else, and it made me horrible. Made me feel so much worse. So I said, okay. And then Dr. Guy Daniels, he kind of said, don't do it. Don't do the yogurt. So I'm trying to do all the right things. I'm taking fish oil. I'm taking NAC. I'm exercising. And yet I'm not getting better. Now, the next thing I'm looking at is called colostrum. Will that heal my gut? I feel like my neurotransmitters are all messed up because of the concussion from my accident. So I'd like and I watched the whole thing on the gut brain axis, but really no direction into what to do. And these are the things I've been doing, and they've not been working. So any advice you can give me on that would be so appreciated.
Okay, so quick question here. What has made you focused on your gut as the main underlying issue here?
Just because I'm a researcher. I look everything up, and they say 90% of our neurotransmitters are made in our gut. And so I said, okay, I'm doing everything else, I'm exercising and taking supplements, not getting better. Okay, it must be my gut. And everything I read about concussions, it really disrupts your gut and inflames your brain. So my thinking is, if I heal my gut, my neurotransmitters will improve and my mental status will improve. And it's been a year now, 5 months of L-glutamine yogurt, and I've not gotten any better.
Right. Okay. So I understand where you're coming from, but when it comes to persistent concussion symptoms, we present in the course a number of factors that can contribute to those symptoms. Gut dysfunction is one possible factor, but it's not always the main issue. Even when most of serotonin is made in your gut, 90%, that's where a lot of that information comes from. That serotonin actually doesn't make it into your central nervous system. Serotonin does a lot of other things than actually just be a mood balancer. It's just like the name suggests, serotonin, it's toning your vascular system, your blood flow. So I think for a moment, let's just play a game here for a second. Let's just look at the information that your well-intentioned endeavors have kind of given us. Number one is you've done a lot of research and a lot of education on gut supportive things. You've tried them for the last 6 months and they haven't made a difference. So right away, that should be a flag to say, maybe your gut isn't the main underlying issue, because there could be a number of other things that can be causing what you listed as your main 3 symptoms. And just remind me again, you said anxiety, depression, and what was the third one?
Dizziness, but the dizziness isn't as bad as the anxiety and depression.
Right. Okay. So now anxiety and depression, we know that inflammation can play a role. We know the gut can play a role, but clearly I think for you, based on what you've tried, it's not something that you can modify with nutrients and supplements. So let's just for a moment imagine that it's not gut related. What are some other things that you've tried to do to address anxiety and depression? And also, last thing I'll say, forget about the concussion thing for a second. Just for a moment, just forget about that. It started after that. How have you addressed anxiety and depression directly?
Okay, one of the things I do is I meditate. I meditate easily 2 times a day, 2 to 3 times a day when I just feel off. I have insomnia. I listen to sleep hypnosis at night. meditate, I pray, I become very spiritual. I've surrendered to a higher power. I've done everything from a spiritual level to emotional level. I exercise. Well, I mean, I should be at the gym now. I go to the gym and I do a stationary bike. I do weights. What am I missing?
Yeah.
I'm so frustrated. What am I missing?
Yeah, I hear your frustration for sure. And I can see Melinda chomping at the bit, wanting to say something here. And I know that she has some valuable insight. Have you worked with a mental health professional, a psychologist or a psychotherapist like
Yes.
Melinda?
Yes, I have. And all they want to do is put me on SSRIs. And I have had not responded to them. I have had bad things with them. I've actually done transcranial magnetic stimulation twice, and that didn't work. So it's not for lack of trying. I see a psych person, all she wants to do is put me on another, and then I read the side effects of it. So that's why I'm trying to do it naturally with the L-glutamine yogurt and the colostrum. And then another question is, what about microdosing mushrooms? You know, that scares me, but I've read good things about that. What's your opinion of that?
Yeah. Well, I'll come back to the mushrooms in a second, but I think I'd like to bring in Melinda here because it sounds like the mental health professionals, if they're pushing pharmaceutical options on you, they may not be well trained in things like actual psychotherapy. So, Melinda, do you want to have any comments on that?
Yeah, I'm just hearing it as I've been kind of listening here, that it sounds like the anxiety and depression isn't a new onset since your concussion. Is that right?
That's right.
It was something you lived with before.
It exacerbated.
It got worse. Yeah. And that's something really common that we do here. Was the anxiety and depression managed before your injury?
Not really, and that's why I've undergone the TMS twice, and it just hasn't done anything. But it was under control prior to the injury. It was under control, but and I thought I was, I went skiing and I was in a pretty good place, and I met my son out there in Breckenridge. And I was in a pretty good place. And then after that, it just got worse and worse and worse.
Right. And so, just knowing that that's a really common experience, if we did have underlying anxiety and depression, that sounds like it was hard to treat. You did get there and you did find some things that were helping to manage it. And then you get a concussion, it can really elevate or heighten that experience. And remind me, how long ago was your concussion?
Oh, it was February. It'll be a year this next month.
Okay. And was the anxiety and depression treated by, so you said you tried a bunch of things, but basically the providers you saw deemed it treatment resistant?
And that's why I said, well, let's try the gut. Let's heal the gut.
Yeah. Well, just to get that sense of the background. And I totally see, why you're looking at gut and trying to, look at things from a different perspective. Anxiety and depression is complicated, right? As much as we're not sitting in a therapy office, so I can ask more specific questions about the root of anxiety and depression. I can't really comment on, what approaches you've done to support that, and maybe where something might have been missing. You're welcome to send me a direct message if you'd like, and I can maybe help guide you with the types of treatment you've already explored for anxiety and depression, and maybe something that could have been missed. As far as how it connects to concussion, as much as it feels like a year is a long time, a year is not a long time to try to get mindset and mood under or back to balanced following a concussion. So I think you're on the right track as far as inflammation goes and trying to support that. Where are you in the program right now, in the Concussion Fix program?
I just made it through the gut-brain axis. And,
okay.
So I'm all the way through that.
And did you go through my sections in like a slow pace? I know you said you're a nurse, is that right? So you probably know a lot of this, but what we always suggest is for clinicians to take their clinical hat off when they go through the recovery mindset and the nervous system regulation, because otherwise we go in with like our science mind, like, I know this already. I've already applied this, I meditate. But sometimes, and we've heard this so many times through the program, is that sometimes clinicians, it's a struggle to take the clinical hat off, and then you miss things. So the invitation for clinicians going through our program following concussion is to try to take that clinical hat off, go through recovery mindset and the regulating your nervous system as if you're a patient. You don't know any of the background. So you're looking at it from a fresh lens of things you might not know about yourself yet, not from the lens of a clinician where you do know all these concepts from an academic or research perspective. So that would be my main recommendation. And if you would like to reach out to me by direct message and help me understand sort of the avenues you've been through already for anxiety and depression, I might be able to support you that way.
I appreciate that. But okay, I just want to know,
And the secondary, I know you're really just wanting to focus on gut health, and I think that's where Dr. Paul can hop in. But the foundational part, that mood, is really important, because when that's dysregulated in some way, it can be really hard to get traction in the other areas we're trying to support.
Well, I do a lot of that. I mean, I've done the meditation. I walk around barefoot. I become very spiritual. I connect with all the things that you were promoting were things that I've been doing, between the meditation and the grounding.
Yeah.
And
Yeah, it sounds like you're really in tune with that, and that's been helpful, but not helpful enough.
no, I can't walk around now because we got snow on the ground, so I can't go outside barefoot. But I get
Yeah.
the benefit of doing that.
Right.
Yeah, absolutely.
Whenever somebody does any sort of treatment, medication, supplement, even a dietary regime change, and it's not working after 6 months, you're still noticing the same symptoms over and over again, then we have to reevaluate what we're doing. This is the same for manual therapy. There's something in your mood case, specifically that aspect, that has not been addressed. And I would suggest that you don't continue going down the gut path and stop fixating on that, because clearly it has not done anything for you. In fact, you believe it may make things worse. There are other things that I think can be done to address mood. And, I think you're, like Melinda said, I think reaching out to her might be helpful to kind of guide you on the right next steps in terms of your psychotherapy, because I think that's going to be a key piece. Someone has to look at your case and not look at you like, you got to give her a pill, or there's not going to be a magic bullet here, it sounds like, because it's been there for such a long time. So concussion is something that you experienced last year in February, and it's clearly an exacerbating factor. However, it probably is not the key underlying factor, and that's been there for a long time. So there's going to be some other things that have to be looked at, and I doubt a probiotic or a yogurt will do anything for that.
Yeah, and like I get that connection too around when I go down the psychology routes, they're offering me a pill. So it makes sense to be resistant to going down that route. But like Dr. Paula commented earlier, that's not the only way to address mental health. So that might have been sort of like a dead end for you. You don't want to do medication. So then it may kind of close the doors on psychology altogether. But I would invite you to sort of, keep that mindset open to different ways of approaching anxiety and depression that can still help stabilize your mood, and then subsequently support some of these ongoing symptoms you've had since your condition.
Last thing I'll say, I am actually doing a live presentation, I believe in 2 Thursdays, on actually using natural supplements and nutrients to support mood. So that's actually on the 29th of January. So if you want to stick around and wait for that, just put that on your calendar. So I'm going to be talking a lot more about how I approach mood balancing from a nutrient and dietary perspective, because so many people have the same question you have. Mood is a massive consideration in your concussion recovery process, and it needs a special approach sometimes.
Oh, I really look forward to that. I'm also taking a lot of fish oil. Do you support fish oil?
Yeah, so there's some evidence, of course we do. There's lots of evidence for its ability to support inflammation. But when we're dealing with other things like mood balancing, fish oil has a benefit more so when it's high EPA, which is a very specific type. So there is some nuance. It's not just taking fish oil. It's about taking the right type and getting the right dose. I'm gonna share all that in that presentation, okay?
All right. All right. That's on the 29th.
29th, 10 o'clock Eastern time.
Okay, I'll be anxious to hear that. Thank you so much.
Hopefully not anxious. You're going to be looking forward
Excited.
to it.
I'll be
You're excited.
I'll be
That's what I was going to say. Excited,
Right.
thrilled.
And in the meanwhile, keep plugging through the program. Like I think that's key. Is like you really have to get through and implement every aspect of the program. We keep reiterating that. I feel like we're like a broken record, Cam?
Yeah, no, I
Like,
see the value in
well,
that.
Yeah, I mean, I think that, like, she's talking about gut, she's doing like probiotic yogurts and stuff like that and trying to do it. But like, there's other aspects of diet that may be involved, right? So it's like once you get to that and change up some of those things, that may have some beneficial effect. But there's also all sorts of other things, right? Like, if your autonomic system is a little bit dysregulated, you said you can do exercise and that's great, but you may still be sitting at a sympathetic kind of overload. You mentioned you're having difficulty with sleep and insomnia. Well, that's going to perpetuate anxiety. So maybe, doing some more sleep modification could have an impact. And then, even neck dysfunction can cause dizziness, and it can also help drive some of these things because it does affect your autonomic nervous system. So there could be some neck implications. So just like we said earlier, it's not necessarily just like fixating on the gut and thinking that's the whole reason. It's like potentially adding in different forms of talk therapy, not medication based psychology or psychiatry, right? It's going talk therapy. Is there, unresolved childhood trauma issues that need to be looked at and really need to go way back since this was pre-existing? And then also taking a look at everything as a whole, right? Like neck dysfunction, not only gut, but also diet and inflammation, and also, autonomic balancing, and, maybe cold water exposure and breathing exercises and other additional pieces in addition to talk. That it's a very comprehensive global picture. And I think the program and going through that and implementing it in a full way will help you to kind of narrow in on areas you need to focus on. So I would say just keep kind of going with it. And yeah.
Yeah, I've been jumping in the ocean for the cold therapy. People think I'm nuts.
Good for you.
I go
Good for
down
you.
there and the waves are pounding and I'm
Oh my God.
friggin' 30, 40 degrees out and I
Yeah.
go straight in, I jump in.
I do it every morning. It's
That's cool. That's
it's
cool.
wild.
Lack of trying, guys. It's I've
Oh, I know.
We believe you. We
I
believe
know.
you.
Yeah.
Yeah, we
know.
hear you, and hopefully it feels like we're on your side, because I know it can be really discouraging when mental health feels like the first and most primary thing, and sometimes it is just a tough battle with that one. So it sounds like you're really doing everything you can.
And then just one last thing. It won't hurt if I do the colostrum.
No, it won't. Just so you understand, I'm sure you've done your research on colostrum. It's like that first milk that any mammal gives its newborn baby, and it's super rich in these proline-rich peptides, PRPs, and they have some evidence that they're really brain protective. And that's like evolutionary when you think about supporting the growth of a baby's brain in the first weeks of its life is absolutely foundational. And so you can purchase bovine or cow-based colostrum, or even sometimes like sheep-based colostrums, to try to harness some of these proline-rich peptides. But that colostrum does not improve mood issues. So I just want to make sure we are in line with the evidence. It is helpful for gut healing, but I'm not convinced that there's a gut problem for you at all. I think you fixated on that because I think that there's one possible mechanism, but you've been doing that with all these different yogurts. Sometimes it could be, you can't get discouraged if one therapy doesn't work, but also you need to realize if it's not working after 6 months, I got to move on. I got to move on to something else. And I think that's part of what we try to share in this course, because so many people come at things from very different angles, and post-concussion issues, persisting concussion issues, there's not one size fits all. You have to find what is your underlying linchpin, right? So that's maybe we'll leave it at that, and hopefully you'll keep plugging away through the course and get some more insight for yourself.
All right. I appreciate your time. Thank you very much.
Thank you for the questions.
Okay.
There's just one question in the chat. I thought maybe we could answer real quick before our time is up for today. Any thoughts on cranial
sacral?
Yes. In general, and then specific to headaches as well.
Cam, you want to start?
Yeah, I mean, it's one of those things where some people find it really beneficial and others don't. So it's kind of a trial and error type situation. Like all of this stuff, right? Like I give the example all the time that like my approach tends to be like pretty aggressive ART, where I'm like really getting in there and kind of peeling back the layers of the onion and getting into different tissues and really going aggressive. And sometimes that doesn't work for people. And then I'll refer them to an osteopath who has a different approach, different set of hands, different way of looking at things, and they get better. So everyone is different. They respond to different modalities, and really it becomes a lot of trial and error. So, yeah, I would say try it. And, you know, you have to give these things a little bit of time, though. You have to be able to commit for at least, 4 to 6 weeks of doing it. But you should be noticing improvement in that time if it's going to work. And if it's not working, then you say, okay, well, it's not working. But every practitioner is different. Every set of hands is different. Like you go to one craniosacral therapist and it doesn't work, and you go to another one and it may work great. So it's really difficult because different people respond to different things, different techniques, different styles, different approaches. So it's a challenge.
I would echo the same thing with my patients. I've had some people that say, oh, that really helped me. And other patients will say that actually made them worse or didn't do anything. So I totally agree with you, Cam. Craniosacral is one modality, and you have to match up the underlying issue with the modality that it works for you. And that may, you could see a chiro, you could see an osteopath, you could see a physio, and all three of those providers trained in different ways, similarities, but different ways, they can all help you with your particular issue. And so there's not one size fits all. And hopefully that we've been able to share that through the Concussion Fix program, is that you have to kind of figure out what works for you.
And the other thing, right? You're matching the issue with the modality. It's like, okay, you have headaches. Okay, well, that could be inflammation. That could be autonomic. That could be neck. That could be visual, right? So it depends. If your headaches are coming from autonomic dysregulation, then craniosacral probably won't help you at all. If they're coming from an inflammatory issue, then you probably better focus on diet, sleep, exercise, right? So it really depends on what's driving those headaches. And I think if you go through the program first before you get to the tip of the pyramid and address all those foundational issues, you'll know, do I actually need any type of rehab at all, or have I already fixed it by addressing inflammation? Mm-hmm. That's why rehab comes last.
Awesome. Great spot to wrap it up for today. Thank you everyone for coming on, asking your questions. A lot of great discussions in the chat as well. So I hope everyone has a fantastic day. Bye.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.